Good afternoon, dear colleagues. The topic of our study is radiology findings in stroke patients with dolgiectasia of the basilar artery. Dolgiectasia of the cerebral arteries is an arteriopathy characterized by dilation, elongation, and tortuosity of the cerebral arteries. Known risk factors for dolgiectasia include age, hypertension, male sex and smoking, connective tissue diseases, for example Marfan syndrome, and lysosomal accumulation diseases such as Fabry disease and Pompe disease. Intracranial dolgiectasia most common affects the arteries of posterior circulation and basilar artery in particular. Clinical manifestations of vertebrobasilar dolgiectasia vary widely. Some cases may be asymptomatic. In some cases, dilated and tortuous artery can cause brainstem and cranial nerve compression or obstructive hydrocephalus. Intracranial hemorrhage due to rupture of basilar artery may occur, but the most common presentation of vertebrobasilar dolgiectasia is the ischemic stroke. Purpose of this study was a comprehensive radiology evaluation of stroke survivors with basilar artery dolgiectasia. 10 patients with a recent ischemic stroke and basilar artery dolgiectasia, according to the Fleming criteria, were enrolled. The comparison group consisted of 1,000 stroke patients without basilar artery dolgiectasia. Brain MRI with time-of-flight MR angiography, CT angiography of the cerebral arteries, brain CT perfusion, and duplex ultrasound were performed for each patient. 2 patients with basilar artery dolgiectasia underwent contrast-enhanced MRI of the vascular wall. In ischemic stroke patients with basilar artery dolgiectasia, anterior circulation infarction was found in 7 cases, and posterior circulation infarction was found in 3 cases. The pathogenetic variance according to the TOAS criteria was established in 3 cases, and 7 cases of ischemic stroke were cryptogenic. The diameters of all assessed intracranial arteries of patients with basilar artery dolgiectasia was significantly higher. Half of the patients had internal carotid artery or middle cerebral artery ectasia or saccular aneurysms, and most of the patients had bilateral or unilateral intracranial vertebral artery ectasia. Blood flow velocity in all cerebral arteries in patients with basilar artery dolgiectasia was significantly lower comparing to the control group. Basal wall MRI in patients with basilar artery dolgiectasia showed contrast enhancement of basilar artery wall as well as contrast enhancement of other cerebral arteries walls. So, in small cohort of stroke patients with basilar artery dolgiectasia, similar changes of other arteries were also detected. It could indicate the generalized nature of the pathological process. Thank you for your attention.